Hey everybody, Dr. Dalton here. I want to go through today a technique that we like to utilize in the office with our patients called DNS, or dynamic neuromuscular stabilization. Now what it is it's a therapeutic rehabilitation system that we like to utilize that helps with human locomotion and improving human biomechanics through different movement patterns that we can put you in that will help reconnect the nervous system and the muscles together to kind of help start building up balance and stability and improve motor learning in the human body. So DNS is based upon what they call developmental kinesiology, which is just typically the process of how a baby goes through these milestones as they're maturing, as their bodies are starting to kind of stabilize and support themselves, as they can kind of start moving around more. So as a patient in the office, what we tend to notice is that we are losing that kind of stability and that support of the human body, and we're tending to get compensation muscles that kind of overwork, and they become painful and discomforting and tight. So what we like to do in the office is kind of get us back to the basics, get you back to those milestone positions that you accomplished as a child. We get you back into those positions to kind of start reconnecting the body, rebuilding that motor control, and teaching your body how to stabilize and protect you in a better fashion so you can reduce some tension and improve your locomotion throughout the day. All right, guys, so for example, we're going to start here at 3 months. So 3 months, a baby should be able to utilize their core strength, their diaphragm, to kind of give them in this position where they can sit up on their elbows and then stabilize their shoulder blades. So as you can see, is we have an adult here that you can be put in the same position and start reworking on those shoulder blade stabilization patterns to, one, take some pressure off of those upper traps, where we get all that tension and stiffness throughout the day, as well as start just giving some support to your shoulders, elbows, down into the arm, because what we're looking for is proximal stabilization for distal mobility. So what we like to utilize this 3-month position for is patients with any kind of upper back, neck, shoulder issues or discomfort or pain, because what this is going to help do is going to help kind of reset that entire system and start kind of helping with stabilization patterns of that upper body, the shoulders, the neck. Like I said, it's going to help take some pressure off of the upper trap muscles, where a lot of people just hold their tension nowadays. So I think that these patients benefit the most from this position if we're dealing with something kind of shoulder blades and up. So you can kind of see over here on this picture that we're looking at kind of a 3-month to a 7th-month transition. So as you can tell, we're not doing a whole lot in that 3-month other than just kind of stabilizing a couple small areas, where as you start to progress through the different months and the different milestones, just like a baby or a toddler, their body is learning how to stabilize and support themselves in more dynamic movements, as should an adult at this point. So what we can typically do is get you back into kind of these same positions, and as you see here, 7th month to 13th month, 7 months, we're starting to kind of roll over. We're working on multiple stabilization patterns. We're working on, kind of one whole side of the body stabilizing, just compared to kind of a, like a small spot, over here in the younger months. So as you can see, we're getting into the kind of the more difficult moves, but this is working on kind of more complex movements, better stabilization patterns in the body. All right, so what we're working on right here is a 5-month pro bar position. It's a DNS pattern. And what we're working on is strengthening kind of this right shoulder. We're having some subscap pain, as well as some upper trap stiffness and things like that. So what we're going to work on is kind of rewiring the shoulder girdle, teaching her how to kind of stabilize and support that shoulder again. So what we're going to do is you're going to stack the shoulders. You're going to lay on top of that nice shoulder. You're going to be 90 degrees with the arm here, 45 with the bottom. What you're going to do is big breath through the belly. Nice and strong core, pressure through the elbow. Show me some daylight. So bring me this arm up, up. Hold. Good. And then slowly back down. Nice breath through the belly. Okay, pressure through the elbow. Up. Arm will rotate. Good. Back down. We're going to do one more. So nice breath through the belly. Nice and strong, perfect. Rotate that arm. Nice and straight here. There you go. Good. And slow back down. Excellent. Okay, on your belly. So the next one we're working on is what they call 3-month prone. Okay? We're working on the same thing, stabilizing, supporting that shoulder blade. All right, so forehead on the table. Good. Same thing we're going to do here is big breath through the belly, pressure through the elbows, nice and tucked chin, elongating the spine here. Okay? So at home, you're going to hang out in this position for 30 seconds to about a minute, okay? Because you're not going to have anyone at home really cueing you. But while we're here, might as well use me, right? So let's do this. Don't let me push up these shoulder blades. Hold them right there. Push, 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 push. There you go. Nice. Good. And meet my resistance right here. Do you let me push these shoulder blades in? Push, 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 push. Good. Relax the shoulders here. There you go. Okay. Same. Let's try it again. Don't let me meet my resistance. There you go. That's what I want right there. Perfect. Good. Okay. And do not let me push the head down. So hold that position right there. Hold, hold, hold. Keep holding, keep holding, keep holding. Push, tuck the chin. There you go. Hold, hold, hold. And relax. Good. Relax all the way down. Guys, so if you have any questions about any of the DNS work that we do in the office, it is something a little different than you'll typically see in most offices. There's not a whole lot of DNS practitioners out there, but we like to utilize it because we see really good benefits from it. So like I said, if you have any questions or concerns, give the office a call. If you want to give it a shot, just give us a call and we'll be happy to help. Thanks.